What should you do if you think you have diabetes? Talk to your doctor if you believe you have diabetes or you suspect you have. That is the best option to find out, and the doctor may recommend certain tests, example, a blood test, to determine if you have diabetes or not. And from there, once you've got your results, you can actually move further whether to rule out that you don't have diabetes or to further test to confirm whether you may have. There are various tests that you can find out on the conditions that lead to diabetes. Now, managing it effectively is key to controlling your symptoms and preventing more serious health problems. Now, type 2 diabetes causes a person's blood sugar levels to become too high and actually is quite a common disease. If you can identify the early symptoms of this chronic condition, it can result in a person getting treatment sooner, which reduces the risk of severe complications and may sometimes be able to stop the situation in its track. Really depends on the case to case and how far or how fast you find out. Now, type 2 diabetes is a common condition, as I mentioned, much more common than we know or we think. People with pre-diabetes have a higher than normal blood sugar levels, but doctors do not consider them to have diabetes yet. It may be considered as a borderline case, and people with prediabetes often develop type 2 diabetes within 5 years if they do not get treatment. Hence, it is important to go for regular health checks or blood tests in order to find out early if you have prediabetes. At least I would say that once a year do a blood test to see whether you have a high blood sugar level or other symptoms. Now, the onset of type 2 diabetes can be gradual, so much so that you do not have any certain signs and symptoms can be mild throughout the early stages. As a result, many people may not realize that they have this condition until it may be way too late. In this article, we look at the early symptoms and signs of type 2 diabetes and the importance of early diagnosis. We also discuss the risk factors involved. Now, what are the early symptoms or signs of type 2 diabetes? It can be frequent urination, which is very common sometimes for elderly folks or as you grow older or you drink too much water. When blood sugar levels are high, the kidneys will try to remove or reduce the excess sugar by filtering out the blood. This can lead to a person needing to urinate more often, particularly at night. Increased thirst. Now, this is not due to the hot weather. Frequent urination that is needed to remove excess sugar from the blood can result in the body losing additional water, and this can lead to dehydration and make the person feel more thirsty than usual. Do you always feel hungry? Constant hunger or thirst can be early signs of type 2 diabetes, but of course, not all hunger and thirst may be the result of diabetes too, especially if you have been around and having your normal or regular meals on time. People with diabetes often do not get enough energy from the food they eat. The digestive system breaks food down into a simple sugar called glucose, which the body uses as fuel. In people with diabetes, not enough of this glucose moves from the bloodstream into the body cells. As a result, people with diabetes too often feel constantly hungry, regardless of how recently they have eaten and how much. It is a vicious circle and it feeds on itself, and the more you eat, the more you feel like eating, which leads to weight gain, which is again a bad factor for diabetes too. Feeling very tired. Type 2 diabetes can impact on a person's energy levels and cause them to be worn out or very tired. Now, this tiredness occurs as a result of insufficient sugar moving from the bloodstream into the blood cells or the body cells. Blurry vision. An excess of sugar in the blood can damage the tiny blood cells or vessels in the eyes, which can lead to vision appearing blur. This blurry vision may occur in one or both of the eyes and may come and go. So if a person with diabetes goes without treatment, the damage to these blood vessels can become more severe and permanent vision loss may actually result. Slow healing of cuts and wounds. Now, high levels of sugar in the blood can damage the bloody nerves and blood vessels, which can impair blood circulation. As a result, even small cuts and wounds may take weeks or months to heal. Do take note of this, and if you have any symptoms, do go for a checkup. Slow wound healing also increases the risk of infection. Now, the last item is the tingling or numbness or pain in the hands or feet. Now, high blood sugar levels can affect the blood circulation and damage the bloody nerves. In people with type 2 diabetes, this can lead to pain or a sensation of tingling or numbness in hands and feet. This condition is known as neuropathy, and it can worsen over time and lead to more serious complications if a person does not get treatment for his diabetes. So please do note the cautions and be ready to check your blood test regularly.